You're welcome to the Diane Show. We never saw yesterday. The day has come. I have an expert with me who is going to be taking us through family planning, and she's going to introduce herself. You're welcome to the Diane Show. Please introduce yourself to our viewers.
Thank you so much, Diane, for having me and inviting me to your show. I'm glad to be here, and I'm ready for the conversation.
Okay.
Let's start.
People need to know your names, what you do, of all people, why you. Yeah.
Oh, wow. Thank you so much. And to our viewers, my name is Mary Ann Waithaka. I'm a medical clinical officer, and I also call myself a family planning expert, originating from Mary Stopes Hospital. Yeah.
Yeah. So, Mary Ann, as women, we struggle with family planning.
Yeah.
There's someone watching the Diane Show who doesn't know what family planning is and what methods are there. Can you please take us from there?
Thank you so much. To our dear viewers, when you talk about family planning, it means quite a lot. From conception, from planning a pregnancy, from managing your family. But in this case, we are talking about when, we are talking about how you're going to prevent a pregnancy, and what methods are available for your child spacing as you plan for each and every pregnancy and childbirth.
Okay.
Yeah.
Yeah. Not you just can't keep giving birth. You need to plan. You need to know I'll be giving birth to my babies every after 2 or 3 years. But that's not something your body can manage if it's not helped. Mary Ann, what options are there for family planning?
Thank you very much. There are quite many, but we usually classify them in several categories. One, we have a category of short-term methods.
Yes.
We also have long-term methods.
Short-term, we're talking about the morning after pills and
yes. The short-term, we have the emergency pill is what people call the morning after pill. Yes. We also have the everyday pill that women swallow on a daily if you choose it that way. We also have the condoms.
Yes.
They're also a short-term contraception. Condoms, both male and female. And we also have the methods that fall under natural. That is like the mood beads. Those are things that you can use them for a very short period.
Okay.
Then we go to the long-term methods. This is for a woman, a lady, a mother who would want to space or prevent pregnancy. Like the word says, long term.
Yes, like maybe you're done giving birth, your target was 2 children, and you're done, so you want something that is going to take you a while.
Yes. Being done with having children, meaning that you've reached the desired number of children, you don't want to have more children.
Yes.
That will fall under the category of permanent.
Permanent.
Yes.
Oh, okay.
Because you're done with your 6 babies, your 4, your 3, your 2. That is what you ever wanted in your life. So that falls under the permanent contraception. The long term is a contraception of like the 2 years, the 3, 5 up to 10.
Yes.
Yes. The maximum for long term is 10. So those are the types.
Okay.
There are quite many. Of course, I believe as you continue the conversation, we shall get to know maybe each and every if time allows.
Okay.
But those are the categories that you consider.
Okay.
Yeah.
There are also hormonal and non-hormonal. So let us get to know. There's a lady out there watching.
Yeah.
She wants to try out family planning. Usually, when you've just given birth, you don't know what to do. Let's assume you've just had your first baby and you're thinking, what should I use? Because you don't want to conceive when you're still in that stage of...
True.
Yeah.
Yeah. And that's very true. And we come in so that we help with giving information and also helping you make a right decision on what can really work for you. So much as we mentioned about the short and long term, when we are doing when you are trying to get you a contraception or family planning of your choice, we look at how long would you intend to prevent this pregnancy. When are you planning your next spacing? Is it 2 years? Is it 1 year? So we consider these methods depending on your preference.
Yes.
That's where the hormonal and the non-hormonal methods come in. And that's how also people tend to separate the family planning methods. Remember, I'd mentioned about the long-term and short-term?
Yes.
Yes, but when it comes to the hormonal, when you say it's hormonal, a hormone is like a drug that you're depending on, that you're going to swallow, that you're going to have it injected in you,
Yes.
or an implant that you're going to place on your arm, and the body will absorb that drug to offer you the contraceptive effect.
Yes.
So that's what it means by a hormonal method. And the non-hormonal is more or less like a barrier method. A barrier is like something that is just trying to separate the egg and the sperm from meeting.
From meeting, yes.
So the barrier, the non-hormonal are, for example, the copper IUD is a non-hormonal method, and the obvious male and female condoms.
Yes.
Apparently, those are the only two contraceptive that are non-hormonal.
Okay.
Not considering, considering also the moon beads, they are also part of a way of trying to keep distance or avoiding the egg and the sperm from meeting without using any.
People actually use the mood beads. I feel like that is something they used to use those.
Yeah, they used to use those days, but the fact that these mood beads are still in supply,
that means there are people who use them.
Yeah, there are people who still would consider using them. Though they are restricted to women who have regular cycles. A very regular cycle. A mood bead is just like the calendar method of counting days.
Oh, safe days.
Yes. It's just that, I'll show it to you. It's just that it's a way of, like, you have a bead which you keep reminding you that this is the safe period.
This is not.
So it's more or less like a calendar method, but it's not very effective. It actually won't work for you if your cycle is not regular.
Okay.
If you don't have that consistent 21, 22, 24 cycle, we actually don't recommend it.
Okay.
Yeah.
Now, Musau, our biggest problem, one of the reasons why so many women told me, Diane, we need an expert. You see, when you go to hospital and you're looking for a contraceptive method, you're given implants, sometimes pills or injectables. And these things are really affecting women.
Yeah.
But the problem is hospitals are not coming out to give these women information. You know, when I come and you give me an implant and you don't tell me what to expect and I use it and my life turns upside down. So what should people expect with these family planning methods, especially the implants, the pills, and the injections?
Thank you very much for that. The health workers have a big role to play in educating the community or creating awareness about the options of family planning and how they work and the expected side effects. And also to understand that these side effects will happen, but there are remedies for these side effects.
For them,
yes. There are side effects that we really manage, and there are those side effects that we have just to discontinue the client from using a particular method.
Okay.
But all this comes from the knowledge gap. Sometimes, yes, I would say some health workers are not very well informed. And then also the issue of misconceptions, the issue of the myths around, like, I would say, much as we are health workers, we are human beings. We also use these methods, but we find some health professionals really don't embrace the use of the contraception, much as there is knowledge gap. But for the clients who move to any health facility and would want a contraceptive method, it's good to have time, because during that session is where you open up and the provider or the health worker needs to understand your health history, any health challenges you've had, what have you ever used, what happened with that method, so that they are able to guide you on what can work for you.
Yeah.
So it's more about maybe the knowledge gap, but it's a call for all of us
Yes.
to really give out this information, so that when someone, for example, is complaining of heavy periods, or they are long, she needs to know there's a solution.
Okay.
There are drugs that we can give, or we can just discontinue and maybe try this other method.
Okay.
Yeah.
Yeah, what the nurse omusawo kyagezaako okutunnyonnyola nti sometimes twekolako olugambo awatasaanidde naye tuuka okwogera n'abasawo tukweka ebintu ebimu. So when you get a chance with this health practitioner and you're talking about this family planning that you want to use, make sure that weekolako olugambo, share your medical history, omugambe nti nali nkozesezaako kino oba nze ndwala kino ekirwadde, so that as you're choosing the method you're going to use, she knows whether it's going to favor you or not. Like I told you yesterday, I recently found out that if you have a blood clotting history or if you have blood issues, you shouldn't be using a hormonal method of family planning. Anyway, see you in part 2 as we continue with this conversation. Thank you so much for watching the Diane Show. Thank you for coming, Dr. Mary
Thank you for
Ann.
having me.
Okay.
Thank you.